Hello, I'm David Price, Professor of Primary Care Respiratory Medicine at the University of Aberdeen and Head of the Observational and Pragmatic Research Institution in both Singapore and in the UK. So I'm delighted to be talking to you about Magnify. This is an incredibly important study that's really groundbreaking for COPD. We have new technology, digital technology that enables us to really monitor, self-monitor for the patients, how they're using their inhalers, how that might link to how their COPD is, but also tells us, if we're managing those patients, how people have been taking their inhalers. So this is incredibly exciting. The problem is, it's really hard to show the benefit of this. Classical randomized trials have highly motivated patients in there. They're filling in lots of paperwork for you. Adherence is always perfect in those patients. You never show anything. And the real question that Magnify addresses is if you had this technology available to you in your practice and you used it properly and well, does it give you better outcomes than the usual standard of care? And that's what we're trying to test here. So it's testing in a real world setting. If you have this available to you as a physician or nurse or other healthcare professional to help your patients, do you get better outcomes than if you don't? And I'd like to discuss with you today some of the challenges of implementing guidelines for our patients with COPD. So the current guidelines for the management of COPD state a number of key things. The first is that we need to make a proper diagnosis at the beginning. And we'll discuss that later. Secondly, we should properly assess patients. So that's to understand how many flare-ups they've had of their COPD in the last year. Also, how are their symptoms controlled and what is the impact on their life. So we would do that with a mixture of the MMRC score or the CAT score. Then we need to implement therapy. And the key background therapy for most patients with COPD is bronchodilator therapy. Long-acting bronchodilators generally, often given in combination, to gain control of the symptomatology and reduce the flare-ups. And for selected patients, to add inhaled corticosteroids to that regime. Patients who have more trouble beyond that, particularly people who get lots of flare-ups, may merit more specialist care to particularly think about other drugs that might be added on. So our real-life data from our patient care research database and others' data have shown that it's very challenging managing COPD. And patients often don't consult in an organised way. It's very hard sometimes to organise our patients, but many patients are both under and over-treated. So they're often receiving inadequate bronchodilator therapy or maybe inappropriately too much inhaled steroid therapy. There are also a number of other challenges in that we may not have recorded all the right things we need to capture for our patients. The impact on them, their flare-ups, and also the spirometry may not have been done to the best standards. And we may not have the best data on that in the records. So when I mention the word adherence, I think everyone's heart sinks because they know it's hard to take medicines regularly. Us as doctors, we're bad at it, and our patients are just as bad as we are. And the reality is that there's a number of key reasons. The first is it's about whether they feel they need the medicines. So people may not actually have been convinced by us that there was value in the medicine. So they won't be taking it because they never even believed us in the first place. Or they have beliefs about medicines that they really shouldn't be taking them. Maybe they're going to be harmful. And what our patients are often doing is they weigh up their feeling of necessity to take the therapy versus their concerns. So they're trying to make a sensible decision for themselves. And our job with that is to really help them by explaining the necessity and the needs for the medicines and also addressing any concerns. Beyond that, also people forget. People forget to get their repeat prescriptions, or they forget medicines for some days, and then they feel sort of okay. But if they don't feel the benefits right away, it's very hard to get people to remember. So lots of challenges. How do we overcome some of the challenges with adherence? So the first thing is to have a proper conversation with our patients. And goal setting is incredibly important. So what is it you'd like to be better about your breathing, your challenges with your COPD? And people will often say things like, I need to play with my grandchildren, I want to go to this event or something like that. I don't want any more flare-ups. And that discussion is incredibly important. So you set goals. The second is an honest conversation about how people are currently taking their medicines. So we can use the refill data, how many times they've had their prescriptions. The problem is pharmacists sometimes will automatically do them for them, so they may actually not have been taking them. And then, more excitingly for us, is some of the modern technology, which actually enables us to now start to know how people have really taken their medicines. And that's what's very exciting about this project, is to really understand how people have taken their medicines. So once we've got that information, we then have the honest conversation. And it can be a little bit challenging, but it must not be in a judgmental way. It's very important. You say something like, we all forget to take our medicines. We all don't always believe that they're the right thing to do. What's your situation with that? And how can we best help you? Then you will get the results you want. So exacerbations of COPD or flare-ups from our patients are generally triggered by viral infections, which we all get. It's important to make sure that our patients have the best protection available. So, number one, make sure they've had their flu vaccines and pneumococcal vaccines. Number two is to be sensible. If there really is a massive outbreak of a particular virus going around and everyone's sick, don't go out and catch it from everybody else. It's just sensible. Then the important things are about, does the patient have the right background therapy? And we know that bronchodilators are massively effective at preventing exacerbations of COPD because you've got your lung function high, your lungs are open, you're less likely to flare up. You've got your cold, but your chest doesn't get infected, and it's actually easier to manage. Selected patients will benefit from inhaled steroids on top. And that seems to be, and we've published now recently on this, the people who get the benefit from the triple therapy, so-called, are those with the highest eosinophil counts, normally above 300, and frequent flare-ups, despite bronchodilator therapy. And those are the patients that need the triple therapy. So I'm often asked about some of the challenges of spirometry, and obviously there's a lot of change going on in the UK right now. But to get quality spirometry is often really difficult. And the big problems we see in practice, so just to remind everyone what spirometry is, you've got FEV1, how much you blow out in the first second, and the forced vital capacity, how much you can blow out by the whole end of the breath. Now, invariably, a lot of our patients stop early. And so I always jokingly say, you've got to hear shouting and yelling coming from the nurse's room when she's doing the spirometry. Or if you're the nurse, I'd expect you to hear some shouting and yelling. I don't really mean shouting and yelling, but we need loud encouragement. So it needs to be, keep going, keep going, keep going, keep going, keep going, keep going until the patient's fully emptied their lungs. Because oftentimes they've stopped. So you'll end up with an FEV1 that's right, but the FVC is low, so they don't look obstructed. Another trick, if that doesn't work, and some patients really can't do that for you, is to do what's called a slow vital capacity. And that's where you let the patients so you do your FEV1 normally, hard breath, and then you get people to do a slow vital capacity. So what you do is you get them just to breathe out slowly until they've fully emptied their lungs. And sometimes that, for people with COPD, that can take quite a long time. I've seen people take 15 seconds to fully empty their lungs because they are obstructed. So just let them gently empty their lungs, and that will often solve your problem. It's not as good as an FVC, but it's good enough for you to really have a picture of what's going on with the patient.
Hello, my name's Heather and I'm a respiratory nurse specialist. I've been a specialist nurse for about 30 years now, and that's been in primary care, secondary care and also in the community, looking after patients with all types of lung diseases and managing services as well. This training video will cover how to read and understand the Magnify patient list. Prior to this training session, you should have received a Magnify dereference tool user guide. This will take you through the more technical aspects of how to obtain and view the suitable patient list. It will also instruct you on how to print the patient list and save the patient list as a PDF. The purpose of this video is how to explain how to read and interpret the Magnify suitable patients list for your practice. The patient list shows you all the patients that meet the protocol criteria, wherein the full inclusion or exclusion criteria has been applied. These patients are all suitable for the Magnify study. The list will also show patients that could potentially meet the criteria. The patients highlighted in green meet all the suitability criteria that we're able to check from the anonymised data extraction. For instance, aged 40 plus, have a smoking history, have a read code for COPD, have at least 2 exacerbations in the last 2 years, had a low adherence to their current COPD therapy based on prescription refills in the last year, do not have a consent refusal code indicating opt-out of data used for research, do not have a read code for asthma or evidence of asthma based on blood eosinophils, are on mono or dual therapy for COPD. For each of the patients on the list, you will find the following information. Patient name and contact number. Note that only your practice will be able to see the columns with patient identifiable information such as patient names and contact details. These are not visible to the OPRI research teams or OPC. We need to know their age, their gender, number of exacerbations in the last 2 years, adherence, drug category and drug name, date of patient's last COPD review, patient's FEV1/FVC if available, patient's eosinophil count if available, the number of Ultibro prescriptions if the patient is currently on Ultibro. In order for a patient to be suitable for the Magnify study, the patients do not have to currently be on Ultibro. However, the propeller sensor is only compatible with the Ultibro, and so you should consider if any of the suitable patients who are currently on a different therapy could be suitable for Ultibro in order for them to enable them to try the propeller device as part of Magnify. Please also note that the nurse/stroke practice will need to confirm that the patient has a smartphone with Android or iPhone operating system. Otherwise, they will not be able to use the mobile phone application, which is part of the propeller technology. Currently, the mobile phone application only works with the latest 2 versions of the Android and iOS operating systems. The patient will also need to have a reliable internet connection at home to ensure the technology works properly. The patient list also shows some patients not highlighted, shown as white. These are patients that have an FEV1/FVC of greater than or equal to 0.7. If it's been a while since the patient last had a spirometry done, they may want to consider bringing these patients in for a COPD review and conducting spirometry again. If their FEV1/FVC is then less than 0.7, they would be suitable to include in Magnify. If they had a high eosinophil count greater than 300, that suggests the patient may have asthma. Many may have information missing for either both spirometry or eosinophils. Again, you may consider inviting these patients for a COPD review to conduct spirometry and check blood eosinophils. And if the results indicate that the patients meet the Magnify criteria, you would be able to offer them the adherence technology to them. If you have any questions about your patient list, please contact the Magnify team at magnify@opry.sg or 01223 967 873. Thank you.
Hi there, my name is Julia, and I'm going to be taking you through the Magnify study training. So first on the agenda, we'll start with an overview of Propeller, get some background on who we are and what we do. We'll then go into what the patient can expect being part of the Magnify study. We'll then talk about the sensor we are using for this study, as well as the syncing details. Then we'll go into what the HCP or healthcare professional can expect being part of the study. I will then do a live enrollment demo so that you're well equipped to start enrolling patients. And then we'll end with support and resources that are available for both patients and HCPs throughout the whole study. So before we dive into what Propeller does, I first want to talk about the mission statement that has motivated our team since Propeller's founding in 2010. Our mission, as you can see here, is to improve respiratory health by connecting the world's medicines. And we've made huge strides in bringing Propeller to thousands of patients across 16 countries and counting. We have 7 CE marked devices, one of which you'll get to see later on. And we have over 19 peer-reviewed publications. Our work has also been validated clinically across both asthma and COPD. Here are just a few of those validations. Up to 79% reduction in rescue inhaler use per patient. Up to 35% reduction in COPD-related healthcare utilization. And up to 57% reduction in asthma-related healthcare utilization. So those are some outcomes, but what exactly is Propeller? So Propeller is a connected health platform for COPD patients. And there are 3 main components. On the far left, you can see a sensor that attaches to a patient's inhaler, and it tracks when a patient uses that inhaler. The second component in the middle there is our smartphone app. And the app receives the medication use data from the sensor through Bluetooth in a process of what we call syncing. So the sensor attached to the patient's inhaler tracks when the patient uses it and then sends that information through Bluetooth to the smartphone app. The third and final component of Propeller are the reports available to both the patient in the smartphone app and care teams who are monitoring patient use with our provider portal. This whole process is completely passive for the patient and should only take a few seconds. So from the moment when a patient uses their inhaler with the sensor attached to meaningful information being displayed back to the patient in the app and the care team in the portal, that whole process should just be a few seconds long. And once again, completely passive. We want Propeller to integrate seamlessly into patients' lives, so we make the sensor as unobtrusive as possible so that patients forget that they're even using Propeller. The provider benefit. Propeller provides both patients and care teams with real-time objective reports of medication use and adherence that they didn't have access to previously. This information helps educate patients on the state of their disease, and it also informs treatment decisions for care teams and clinicians. The image you see here is an example of a report that's available to patients. It serves as kind of a monthly snapshot of a patient's COPD, including controller medication adherence and CAT scores. So the patient experience. We're going to talk more specifically about how patients experience Propeller, specifically with this study. Instead of generically using the term patient, I'll be using the name Linda to help illustrate what this will look like for your study. So a little bit about Linda. She was recently diagnosed with COPD, but she loves to play outdoors with her grandchildren. She's a new smartphone user with limited interactions with technology. She finds COPD to be an annoyance, and it prevents her from doing the things that she loves. She talks with several healthcare professionals about her disease and values their input. So that's Linda. Let's pretend that Linda is a subject who was recruited for this study. It's important to first confirm that Linda has a compatible device to use, as that is a requirement for the study. And you can do that by referencing this support article that we have linked down here. It's found on our provider support page, which we'll talk about at the end of the training, but it essentially just details exactly which operating systems are compatible with Propeller. As a good rule of thumb, it's the most recent 2 operating systems. This article is kept up to date by the customer experience team, so you can always reference this if you need to check. Once you confirm that Linda's device is compatible, she will then be enrolled in the study via the Propeller Provider Portal, and I will do a live enrollment demo in a bit of what that process looks like. Once she's enrolled, Linda will download and sign into the Propeller app on her smartphone, sync her sensors for the first time, and then be able to use Propeller to record her medication usages. If you need help assisting Linda with this process, the HCP user guide that you were provided with contains step-by-step screenshots of exactly how to download the Propeller app onto a patient's device, and this is for both Android and iOS devices. It also contains screenshots of exactly the process for signing into the app and performing a first sync. So all of the resources should step and outline exactly what you will see with Linda throughout this whole process. After getting set up in Propeller, Linda will go home and use her inhaler with the sensor attached and begin gaining valuable insights in the app. So this is what she can expect when she signs in. The app is organized by what we call a navigation bar, which is located on the bottom of the app. And as you can see, there are 5 tabs. I'm just going to really quickly go over what each of the tabs are for. The Home tab is where all the daily information about Linda's COPD will live. So these are things that she needs to know that day, such as the daily schedule card you can see in the screenshot. It shows the doses scheduled for that day and if she has taken them or not. And then any other cards pertinent to that day. So we call a block of information a card. So as you can see in the screenshot here, the daily schedule card, there's a tips card, and then it's cut off, but the common symptoms card. So that's what I'm referencing when I say card. The Trends tab is next, and over time the app will start to populate different trends in Linda's medication usages, which can be found here. Timeline. This is an archive of all of Linda's medication usages, and these can be where Linda checks in and makes sure that the app is recording the medication usages she's taking. Records tab is where Linda's health reports live, and that was that 30-day screenshot that we talked about earlier. The Devices tab is where Linda can manage the sensor on her account and ensure it is syncing properly. We also communicate with Linda outside of the app, and this is totally dependent on patient preferences. So she can choose to be notified via email, SMS, text, and push notification. We send a weekly email, which you can see on the left side. And that just summarizes the state of her COPD that week. Once again, makes sure that the doses that we registered accurately reflect what she took. And then we also provide that monthly report that we talked about, which are more detailed and give the information she needs about her use the last month, including any trends that we can gather. We believe that having reliable records of medication use is an important part of a patient understanding his or her COPD. And these tools are also used by HCPs so that they are more informed about the patient's medication use. And it adds both data and value to conversations about the state of their disease, and again, informs treatment decisions moving forward. We'll now go into sensor and syncing details. So this is the sensor you'll be using for this program. It is compatible with Breezehaler dry powder inhalers, which is a controller or daily medication. You can see in the picture here, the inhaler is the top portion and the sensor is the bottom portion. To attach the sensor, you slide the sensor to the bottom of the inhaler and it snaps right into place. So the grooves of the inhaler line up with the grooves of the sensor and it should just slide nice and easy and snap into place. One thing I want to note is there's a clear tab, which you can see in this photo here, and that should be facing you, as well as the Ultibro BreezeHaler text should also be facing you. It won't allow you to put the sensor on backwards, but this just assures that you'll have it the right way and it will just slide right into place. Here's a video to illustrate how to attach. And you'll hear that nice satisfying snap once you've gotten in place. How does the sensor detect a dose? It first recognizes when the capsule inside of the inhaler has been pierced, and it also detects the dose based on patient inhalation. To remove the sensor, all you have to do is press down on that clear tab on the front, grasp the sides of the inhaler, and then slide the sensor away from the inhaler. Here's a removal video that illustrates this. So for the removal here, you can see that they took the cap off of the inhaler first, just to get a better grip on the inhaler and the sensor. So that might be an easier step for you for attachment as well. Propeller sensors communicate with the smartphone every 3 hours and when a dose of medication is taken. It'll attempt what we call a sync, which is again just the sensor trying to communicate with the smartphone app. There is a way for the patient to test to make sure that the sensor is syncing without actually having to take a dose of medication. And it's a small button, you can see in the photo here, it's kind of on the legs of the sensor almost. And the button, once you press it, pushes what we call a manual sync to the smartphone. Once again, so the patient doesn't have to actually use their medication to test the communication. For a sync to occur, the sensor must be within Bluetooth range of the smartphone. The patient's smartphone must be turned on. The patient's smartphone must have Bluetooth turned on, and they must be logged into the application. So as long as all those things are true, the patient should be syncing properly. If the sensor and smartphone are unable to sync, the sensor is able to store de-identified medication use data until a successful sync occurs. So no data will be lost in the event that they're unable to sync right away. The sensor will just store it until it is able to sync. We will now go into the HCP experience as part of this study. Here's the program design overview. The GP practice will see patients in the clinic. They will enroll patients who are clinically suitable and technology accepting during clinic appointment. A sensor is provided to the patient and attached to the med as part of the enrollment flow. From there, GPs and their teams can monitor patients, but this is not required for the study. Here's a screenshot of our provider portal that I mentioned previously. As monitoring is optional, I won't go into all that is in the provider portal, but it is a pretty self-explanatory system to use. One thing I want to call out is this is the system that you will be actually enrolling patients in. And as you can see from the number 1 In the top right corner of the portal, there is a plus sign, and that is where you will start the enrollment process. This is also where all of your patients who you've enrolled will show, as well as their adherence, syncing information, things like that. You will also be identified at-risk patients via the notifications. And then if you want more information on the individual patient, all you do is click on them for what we call a patient drill down. Gives even more detailed information than this screenshot is providing about exactly when patients on an individual level use their medication and what their trends in adherence are. In order to access the provider portal, we must first collect key information from each HCP, including name and email, to create the account. So you should have received, or will receive if you haven't already, a paper copy of the provider user agreement and provider privacy and cookies policy. To finalize your enrollment, go to the specified link, complete enrollment form, and agree to consent. And this form must be completed directly by the enrolling provider, so please use your real name and information, including an individual email that is just to you, not to the whole practice. So here's what it will look like when you open up the consent link. As mentioned previously, you should have already received a paper copy of the agreements. To finalize your enrollment, be sure to complete this enrollment for yourself and complete the consent. So you'll say OK to that, and then you can get started by entering your actual information. So your first name, surname, email address, note that it should be a real email address, but for the purposes of this, I'm doing an example email. Address is optional. As you can see, it does not have an asterisk next to it, so you can just skip address if you'd like and go next. The fifth question is you agreeing to the Propeller Health user agreement, which you can view here by clicking the link. This will take you to the privacy policy for you to read. Once you agree, you can select yes. 6 is that you acknowledge the privacy and cookies policy, which you also can view here. And then once you have read, you can agree to them. And then number 7 is the use of your email address to create an account. Allow the access to the services that are described within the user agreement. If you consent, you will say yes. You will consent that your email address will be used to provide updates related to patients, and that you have the right to withdraw this consent at any time. If you consent, select yes, and then hit done. You should get a final screen here saying thank you for completing this form. A member of the Propeller Health team will create your account within 3 business days. If you do not receive an email to create a password within 3 business days, then please reach out to our support email, which is help@propellerhealth.com. Once you complete the HCP consent process and have credentials to sign into the provider portal, here is an idea of what you will see when you sign in. So you'll see these are just test patients for our purposes today. So there's no actual medication data populated. Hopefully it'll be a little bit more interesting when you first sign in. But this is kind of a high-level overview of patients you've enrolled in this study and what their medication data and syncing information is. To get a more drill-down view, just click the patient, and that will take you to a separate screen. To enroll a patient, you'll start by clicking the plus sign in the upper right-hand corner here. And just something to note, you can see here that once this actually has patients from your practice enrolled, this screen here does have PHI. So if you are in the clinic with a patient, making sure that this screen is facing you and not the patient so that they don't see any information for other patients. But once you click that plus sign, it takes you away and you can then turn your screen so that the information you're entering is accurate and the patient can verify that. So you'll start just by selecting who you're enrolling. We'll say single patient. You'll then enter the practice ID, just as a sample ID. I'll put that in there. You'll then answer if the patient has an Apple or Android smartphone or tablet. So this is something that hopefully was deemed compatible earlier on during the recruitment phase. And you'll be able to just select if they have iPhone, Android, or if they have none of these devices, they will not be eligible. We'll just say they have an iPhone. You'll then enter the first name, the last name, and the date of birth. You'll enter the patient's email address, and this should be their personal email address. It is optional for a patient to enter their phone number. This does give our customer experience team another venue of communication should we need to contact the patient or should they contact us. But it is optional. If a patient is not comfortable entering it, then they can just select next. The patient will then select the medication, which there's only one option here. That's Ultibro Breezhaler. You'll then hit next. You'll select how often Linda takes the Breezhaler. You can see at the bottom here, the Breezhaler approved dosing is 1 capsule once per day. You'll then put how many puffs Linda takes each time they use their Breezhaler. Approved dosing is 1 puff each time. Linda can then set the time that she usually takes her Breezhaler, and this is when Propeller will notify her to take it as a reminder. So if you want to switch it from 9 a.m., you just hit the drop down, and whatever time Linda prefers, you can select. You'll then select what Linda's time zone is. Once again, tapping into it will give you a list of different options. It then asks if Linda has any sensors to use with their Breezhaler inhaler. You will select yes, and then you will find the sensor ID, which is located on the inside of the sensor. You can see in this image here where that is located. It is a 6-digit ID code. It will look something like that, and then select next. There will be no other sensor to add, so you will just then be done adding sensors. Once you've added it, you will press the button on the sensor that we talked about earlier. It's kind of on the bottom side of the sensor. When you press that, a light should flash green. As long as you press the button, you can indicate that. Attach the sensor as you saw in the attachment video by just sliding the inhaler onto the sensor until you hear a snap. You have already added the medication Linda takes, so you can just say done adding. And then you will put in what Linda's preferred language is. Once again, clicking this here will show you our drop-down options. And then you will get to the agreements. So this part is important that the patient will actually be able to see this screen and agree to these things. So we have our user agreement. They will have to accept by clicking this box here. The privacy and cookie policy, they'll be able to, if you go into the box, you can scroll through and read it. They will need to accept that and then hit next. And then we have some pretty standard data sharing agreements. All you do is check the box to the left once the patient has reviewed. And these are pretty, like I said, standard agreements to be acknowledging. Just like if you were to download pretty much any app, there's different consents to give. So the patient will review these. And once they have reviewed each one, hit next. This gives you the final screen, which is review and create account. What you want to do here is make sure everything you have entered is accurate. If you see something that is not, you can actually go right there by hitting this gray pencil next to it. Make any edits that need to be edited. Make sure the patient reviews this and ensures that it's up to date. And then create account. And that is the enrollment process. So from start to finish, it should really only take a few minutes. Obviously, it took me a bit longer in this demo since I was explaining each step, but especially after you do it once or twice, it should be a pretty brief process. And then once you hit finish, you can see your list here with our newly enrolled patient, Linda. After Linda is enrolled in the portal, she will receive an email from Propeller, which she can then use to set her password. Just for your awareness, these are the password requirements. It needs to include one uppercase letter, one lowercase letter, one number, and 8 total characters. So once Linda creates her password, she can then sign into the app. Here are support and resources that are available for both patients and HCPs throughout this study. So we provide both patients and HCPs with fast, friendly, and reliable technical support for any of the Propeller products, which includes the sensor, the app, and the portal. Here are some of the channels that you can use to contact us. And once again, these venues are for both patients and HCPs. We have a local phone number for the UK listed here. Our email is help@propellerhealth.com. We have web forms that you can navigate to with these links. These are distinguished between HCP and patients. So there's one web form for HCPs and one for patients. We also have an online chat. And this information is located in the HCP user guide, should you need to reference these again. Our support team is staffed Monday through Friday from 8 a.m. to 8 p.m. local time, and we offer support in over 25 languages as necessary. So what do you need to do when you contact Propeller support? First, state that you're calling for the Magnify study. You will give your name and then say if you're either from the practice or a patient. Any patient information that you have available, including the patient name, the patient email, the patient phone number, details on the issue to be discussed, whether it be a sensor syncing issue, something you're seeing in the provider portal. And then if you have it, it's helpful to have the sensor serial number, which is that 6-digit number found inside the sensor. Otherwise, if you don't have it offhand, we can try to figure it out with you. So we also have websites that you can go to, including a robust collection of articles, FAQs and videos to help patients and HCPs learn about Propeller and get answers to frequently asked questions. And this is also where that web form lives, so you can contact us directly from these support pages. So there's 2 different URLs to go to. The one on the left here you can see is for providers. So this answers questions that you as a provider may have, including how to enroll a patient, information about the provider portal, things like that. And then on the right you can see the URL is support.propeller.com for patients. And this is more patient-facing, frequently asked questions about sensor syncing, what they do with a refill, things like that. This option is available for patients in the app. They can contact our support team directly via phone, chat, or email at any time. Just as a note, chats are translated automatically through our support center, so they can reach out in any language. And direct access, you can see here in the app, to our user guides, FAQs, and then that patient support center that you saw on the previous page is embedded in the app as well. This is available to the HCP. It is our HCP user guide. And you can see on the left here are all of the topics that we cover, including how to enroll a patient. Once again, as I mentioned previously, screenshots of how to sign into an app, how to determine that an app is compatible. All of those things will be found in the HCP user guide. And that should be all of the resources that you need for a successful study. You should be equipped with everything you need to start enrolling patients, and you can now take the competency assessment to test your knowledge. Thank you so much for listening.